Have you ever wondered why something that's supposed to bring closeness and joy can suddenly turn into a source of discomfort and worry? For many people, this shift happens quietly and unexpectedly, leaving them unsure of what's going on with their bodies. It's more common than most realize, and it affects both emotional and physical well-being. When intimacy starts to bring pain instead of pleasure, it's not just a physical issue. It can create confusion, stress, and even distance in relationships. For men, this situation can be especially challenging. Changes in hormone levels, reduced blood flow, certain medical conditions, or even lifestyle habits can all play a part. Over time, factors like stress, lack of proper nutrition, and a sedentary lifestyle can affect overall health and lead to discomfort during intimate moments. When the body isn't functioning at its best, it sends signals in subtle ways, and pain or sensitivity can be one of them. Many men ignore these signs or feel too embarrassed to talk about them, which only makes the problem worse. The good news is that these challenges are not permanent. A healthy lifestyle can make a real difference. Regular movement supports circulation and overall vitality. A balanced, nutrient-rich diet helps the body repair and maintain tissues. Prioritizing good sleep and managing stress helps regulate hormones and restore natural balance. And perhaps most importantly, paying attention to these signs and seeking proper medical guidance can prevent small issues from turning into bigger problems. This conversation isn't about judgment or shame. It's about understanding what's happening inside the body and learning how to support it in practical, realistic ways. When we focus on overall health, the body often responds in positive, unexpected ways. So today, let's break down why pain can happen, what's going on beneath the surface, and how simple lifestyle choices can bring comfort, confidence, and connection back into your life. When intimacy begins to bring discomfort rather than ease, it's often the body's way of signaling that something deeper is going on. Physical discomfort during moments that are supposed to feel natural and pleasant doesn't appear out of nowhere. It is usually tied to changes within the body that may have developed gradually over time. One of the most common underlying causes is hormonal fluctuation, which affects both men and women as they age. Hormones regulate so many essential functions in the body, from tissue health to blood flow and sensitivity. When hormone levels shift, they can lead to changes in how the body responds, resulting in sensations that may feel unfamiliar, sensitive, or even painful. These changes are often subtle at first, but over months or years, they can build up and start to interfere with physical comfort and confidence. For men, hormonal changes can include a gradual decline in testosterone, which is a natural part of aging. Testosterone supports not just physical function, but also tissue strength, circulation, and nerve sensitivity. When levels drop, tissues can become less resilient, blood flow may decrease, and the body may not respond the way it used to. This can lead to sensations that feel tight, sensitive, or uncomfortable. Because these changes happen slowly, many men may not immediately connect them to hormonal shifts, assuming instead that discomfort is a random or isolated issue. In reality, these signals are the body's way of drawing attention to an underlying imbalance. Another key factor is the health of tissues and nerves in the body. Over time, reduced hormone levels, lower circulation, or chronic inflammation can affect the elasticity and sensitivity of tissues. When tissues are not properly nourished by blood flow, they may become more fragile or less flexible, making certain movements or activities feel different than before. This isn't just a physical issue, it also affects emotional comfort and confidence. If something that used to feel natural suddenly becomes uncomfortable, it can create uncertainty, leading individuals to withdraw or avoid intimacy altogether. Pain can also stem from underlying medical conditions that go unnoticed for years. Conditions such as diabetes, cardiovascular issues, or pelvic floor dysfunction can all influence how the body feels during intimate moments. Diabetes, for example, can affect nerve sensitivity and blood circulation, leading to both physical discomfort and a change in how sensations are experienced. Cardiovascular problems can restrict proper blood flow, which plays a crucial role in comfort and responsiveness. Pelvic floor issues, which are often overlooked in men, can lead to muscle tension, restricted movement, and pain. These conditions develop gradually, which is why it's easy to miss their connection to discomfort until it becomes more persistent. Emotional and psychological factors also play a significant role in how physical discomfort is experienced. When the body begins to respond differently, feelings of embarrassment, anxiety, or frustration can set in. These emotions can heighten physical sensations, making discomfort feel more intense than it actually is. The mind and body are deeply interconnected. When one is out of balance, the other is affected too. For many people, the emotional response to discomfort can be just as impactful as the physical sensation itself. This can lead to a cycle where pain causes worry, and worry increases tension, which then amplifies the pain. Recognizing this connection is important because it shows that addressing physical discomfort isn't just about treating the body, but also about understanding the emotional layers that accompany it. It's also important to acknowledge that these changes can happen at any stage of adulthood, though they become more common after 40 or 50. They are not a sign of failure or weakness, but a natural part of how the body evolves over time. Unfortunately, because topics like these are often considered private or even taboo, many people avoid talking about them. This silence can cause individuals to internalize their discomfort, believing they are alone in their experience, when in reality, countless others face similar challenges. Breaking that silence by recognizing discomfort as a legitimate health signal is a crucial step toward addressing the issue. Many people try to ignore or push through discomfort, hoping it will go away on its own. While temporary discomfort can happen occasionally, persistent or recurring pain is almost always a sign that something inside the body needs attention. The earlier these signals are acknowledged, the easier it is to address the root cause. For example, hormonal changes can often be supported through medical guidance, lifestyle adjustments, or targeted therapies. Circulatory issues may improve with regular movement and dietary changes. Tissue sensitivity may benefit from improved hydration, nutrition, and gentle physical care. The key is to view discomfort as information, not as a personal flaw. Physical discomfort can also affect how individuals view themselves. When the body starts to behave in ways that feel unpredictable, it can shake self-confidence. Someone who once felt secure and at ease may begin to question their vitality, their health, or their ability to connect with their partner. This internal dialogue can be more damaging than the discomfort itself if left unaddressed. By recognizing that discomfort often stems from natural biological changes or treatable health issues, it becomes easier to approach the situation with compassion and practical solutions rather than shame or avoidance. Ultimately, physical discomfort during intimate moments is rarely a random occurrence. It is the body's way of signaling hormonal shifts, changes in circulation, tissue health concerns, or underlying medical conditions that require attention. By listening to these signals rather than ignoring them, individuals can take meaningful steps toward understanding what their bodies need. This might involve seeking medical advice, adopting healthier lifestyle habits, or making small adjustments that support comfort and confidence. When addressed early, these signals don't have to turn into long-term struggles. They can instead become opportunities to reconnect with the body, restore balance, and approach intimacy with renewed trust and understanding. When discomfort replaces pleasure during intimate moments, it's often the result of physical and lifestyle factors that have been building up over time. One of the most overlooked contributors is the way daily habits affect circulation, muscle function, and tissue health. The human body thrives on movement, proper nutrition, and regular care. But modern routines often involve long periods of sitting, high levels of stress, and minimal physical activity. Over time, this lifestyle can lead to poor blood flow, muscle tightness, and reduced flexibility, all of which can affect physical comfort. The pelvic region, in particular, depends heavily on healthy circulation and relaxed muscles to function well. When circulation is compromised or muscles become tense, sensations can shift from smooth and natural to tight, uncomfortable, or even painful. This is not something that happens overnight. It develops gradually as the body adjusts to less movement, more pressure, and ongoing stress. Many men underestimate how much their daily posture and sitting habits affect their pelvic health. Sitting for extended periods, whether at work or during travel, places continuous pressure on the pelvic floor muscles and the nerves that run through that area. Over months or years, this pressure can lead to muscular imbalances, nerve sensitivity, and even inflammation. It can also restrict blood flow to tissues, making them less resilient and more prone to discomfort. When circulation is limited, tissues may not receive enough oxygen and nutrients, leading to subtle changes that eventually manifest as physical pain or heightened sensitivity. Even something as simple as taking breaks to stand, stretch, and move throughout the day can have a surprisingly powerful impact on reducing these effects over time. Physical activity plays a major role in maintaining comfort as well. Regular exercise improves circulation, strengthens muscles, and supports hormonal balance, all of which contribute to a healthier physical response. When exercise is lacking, the body's natural systems for blood flow and tissue repair slow down, and stiffness can set in. This is especially true for the pelvic region, which benefits from both aerobic activity and gentle strengthening exercises. Movement encourages healthy nerve function and helps maintain tissue elasticity, making the body more adaptable and responsive. Without this regular stimulation, tissues can become less flexible and nerves may become more sensitive to pressure, which can lead to discomfort. Nutrition is another lifestyle factor that has a direct impact on physical well-being. Diets that are high in processed foods, sugar, and unhealthy fats can lead to systemic inflammation and poor circulation. Over time, this affects how tissues respond and heal. On the other hand, a nutrient-rich diet that includes plenty of fruits, vegetables, lean proteins, and healthy fats supports blood vessel health and tissue regeneration. Hydration is equally essential, as tissues rely on adequate water levels to stay supple and flexible. Dehydration can make tissues more prone to dryness and irritation, which contributes to sensations of discomfort. Small dietary improvements, when maintained consistently, can create noticeable changes in how the body feels and responds over time. Stress is another major influence that is often underestimated. Chronic stress leads to increased tension throughout the body, particularly in the pelvic floor region. When the body is under stress, muscles tighten as part of the natural fight or flight response, and for many people, this tension accumulates in the pelvic area without them even realizing it. Over time, these muscles may remain partially contracted, even during moments when they should be relaxed. This constant low-level tension can make movements feel restricted and uncomfortable. Additionally, stress affects hormone levels, sleep quality, and circulation, creating a ripple effect that influences physical comfort in multiple ways. Practices that reduce stress, such as mindful breathing, regular movement, and sufficient rest, can help the body return to a more balanced state where muscles relax and circulation improves naturally. Sleep quality also plays a surprisingly important role. During sleep, the body repairs tissues, balances hormones, and supports the immune system. Poor sleep disrupts these processes, leading to slower tissue repair, increased inflammation, and hormonal imbalances. Over time, these disruptions can affect physical comfort in ways that might not be immediately obvious. For example, low-quality sleep can worsen circulation problems, increase sensitivity to pain, and make muscles more prone to tightness. Prioritizing sleep isn't just about feeling rested. It's also about giving the body the time it needs to restore itself, which directly impacts how comfortable and resilient it feels during the day. Another factor that often goes unnoticed is the role of posture and core strength. A weak core or misaligned posture can place excess strain on the lower back and pelvic area. When the spine and pelvis are not properly aligned, muscles have to work harder to support the body, which can lead to chronic tension in the pelvic floor. Over time, this tension affects nerve function and blood flow, setting the stage for discomfort. Simple adjustments like improving posture, engaging in core, strengthening exercises, and ensuring ergonomic support while sitting can reduce these stresses and support better pelvic health. Addressing these lifestyle factors is often the key to reducing discomfort and restoring a sense of ease. Unlike medical conditions that require targeted treatments, these influences are within an individual's control by making small, consistent changes, such as incorporating daily movement, eating a nutrient-rich diet, managing stress effectively, and improving posture. Many people experience noticeable improvements in their physical comfort. The body responds remarkably well when given the right conditions to heal and function. Circulation improves, muscles relax, tissues regain flexibility, and nerves become less sensitive. These changes don't happen overnight, but with regular care, they build steadily over time. Importantly, making these adjustments also has broader benefits for overall health and well-being. Regular exercise, better nutrition, and stress management support heart health, mental clarity, hormonal balance, and immune function. These improvements naturally translate into a body that feels better, responds better, and experiences less discomfort. It's a holistic process where each small change contributes to a larger picture of wellness. Many men are surprised at how much of a difference these lifestyle shifts can make, not just for physical comfort, but for their confidence and quality of life as well. In many cases, discomfort during intimate moments isn't just about one single cause, but a combination of factors that have developed gradually. By understanding how daily habits influence the body and making intentional changes to support circulation, muscle health, and relaxation, it's possible to reverse much of that discomfort. The body is adaptable and resilient, and when it's cared for consistently, it often responds in powerful and positive ways. Through movement, nourishment, rest, and stress reduction, the foundation for physical comfort can be rebuilt naturally and sustainably. When discomfort starts to replace ease during intimate moments, it can feel overwhelming. But one of the most empowering things to understand is that early attention and healthy lifestyle habits can truly change the outcome. Many people wait until discomfort becomes unbearable before addressing it, often assuming it will go away on its own. But the body has a way of giving subtle signals long before issues become severe. Paying attention to these early signs, making small but consistent lifestyle changes, and seeking professional guidance when needed can prevent challenges from escalating and help restore comfort and confidence over time. This process doesn't rely on quick fixes or temporary solutions. It's about building a strong foundation for lasting well, being through daily habits that support the body's natural functions. The first step is recognizing that discomfort is a signal, not something to be ignored or dismissed. The body communicates through sensations, and when pain or sensitivity appears, it's often pointing to areas that need care. Early intervention allows for simpler, less invasive approaches to address the issue. For example, if circulation is reduced due to prolonged sitting, incorporating regular movement and stretching can improve blood flow before the discomfort becomes chronic. If stress is causing muscle tension in the pelvic region, adding daily relaxation practices can help release that tension before it becomes embedded in the body. These kinds of adjustments are far easier to implement early on, and they often lead to noticeable improvements in how the body feels. Healthy habits form the backbone of this approach. Regular physical activity is one of the most powerful tools for restoring comfort. It supports circulation, strengthens muscles, balances hormones, and improves mood, all of which contribute to a healthier and more responsive body. Movement doesn't have to mean intense workouts. Even gentle exercises like walking, stretching, or light resistance training can make a meaningful difference. Over time, these activities keep tissues flexible, encourage healthy nerve function, and prevent the stiffness and sensitivity that can lead to discomfort. The key is consistency rather than intensity. A little bit of daily movement builds cumulative benefits that the body depends on. Nutrition also plays a central role. What we eat directly affects how our tissues function, how well they heal, and how resilient they remain. Diets high in processed foods, sugar, and unhealthy fats can increase inflammation and slow circulation, creating conditions where discomfort thrives. In contrast, a balanced diet rich in whole foods, lean proteins, fruits, vegetables, and healthy fats supports blood vessel health, tissue repair, and hormone regulation. Hydration is equally essential as it keeps tissues supple and less prone to irritation. When nutrition and hydration are prioritized, the body gains the resources it needs to restore itself naturally, reducing the chances that minor discomfort turns into persistent pain. Stress management is another critical aspect of restoring comfort. Chronic stress tightens muscles, affects circulation, disrupts sleep, and alters hormone levels, all of which contribute to physical discomfort. By learning to manage stress early, before it accumulates and takes a physical toll, individuals can prevent tension from becoming chronic. Techniques like mindful breathing, meditation, gentle movement, or simply taking regular breaks to reset can help bring the nervous system back into balance. This, in turn, allows muscles, especially in the pelvic region, to relax, blood to flow more freely, and sensitivity to decrease. The earlier stress is addressed, the easier it is to prevent long-term effects on the body. Seeking medical guidance early is equally important. Many people feel hesitant or embarrassed to talk about discomfort related to intimate experiences, but doctors and health professionals are trained to address these concerns with care and confidentiality. Early medical evaluation can identify underlying issues, such as hormonal changes, circulation problems, or nerve sensitivity, before they become more complicated. This allows for targeted interventions that complement healthy lifestyle changes, creating a comprehensive approach to healing. When medical guidance is combined with daily self-care, the results are often faster and more sustainable. Sleep is another area where early attention pays off. Quality sleep is essential for tissue repair, hormonal balance, and overall physical resilience. Poor sleep weakens the body's ability to heal, increases inflammation, and heightens sensitivity to pain. By prioritizing sleep early on, through consistent routines, comfortable sleep environments, and good sleep hygiene, individuals can give their bodies the time and resources they need to restore balance. A well-rested body is more adaptable, less sensitive, and better able to respond to other positive lifestyle changes. Another powerful benefit of early intervention is the boost it gives to confidence. Discomfort can quietly erode self-assurance, making people anxious or hesitant. But when small changes start to bring relief, confidence begins to rebuild. People feel more in tune with their bodies, more in control of their well-being, and more optimistic about their physical health. This shift in mindset creates a positive feedback loop. As confidence grows, stress decreases, habits become easier to maintain, and the body continues to respond positively. It's not just about eliminating discomfort. It's about reclaiming a sense of vitality and ease that affects every part of life. Preventing issues from escalating also reduces the emotional strain that often accompanies physical discomfort. Ignoring pain or hoping it will go away can lead to frustration, anxiety, and feelings of isolation. Addressing it early sends a powerful message to oneself that your well-being matters and deserves attention. This proactive approach fosters self-respect and encourages a healthier relationship with one's own body. It shifts the focus from reacting to problems to actively preventing them, which is a much more empowering place to be. It's important to understand that this process doesn't require perfection. Consistent, realistic steps make the biggest difference. A short daily walk, more water, a few minutes of relaxation, a balanced meal, and an earlier bedtime might seem small, but over weeks and months, they transform how the body feels and functions. These habits build resilience, making the body less prone to discomfort and better able to recover when challenges arise. By establishing these habits early, individuals give themselves the best chance of maintaining comfort and confidence as they age. Ultimately, addressing discomfort early through healthy lifestyle choices and proper guidance is not just about solving a single problem. It's about building a stronger, more balanced foundation for overall health. When movement, nutrition, sleep, stress management, and medical support work together, the body has everything it needs to heal and thrive. What starts as a small effort to address a specific issue often blossoms into a broader transformation in how a person feels every day. The discomfort that once seemed confusing or intimidating becomes manageable, and often it fades altogether as the body responds to the care it receives. This approach allows individuals to move forward with greater comfort, confidence, and peace of mind, knowing that they've taken active steps to support their well-being before issues could grow larger.